and today. I'm going to start with this story because it's a story that's close to home. I think anyone that gets into sleep-related or breathing-related orthodontics has a personal story that's affected them or a family member. This is my story. This is Maddie. Maddie is my goddaughter. She is the daughter of my cousin, Adrian and Zach. And about 3 or 4 years ago, we were at a Thanksgiving function, and Adrian was asking me what I do and what's going on with my career. And I told her I'm starting to get into Airway things, and I'm lecturing on Airway. And we talked a little bit about snoring and breathing. And she said, well, Maddie snores. And at that time, I had learned that children are not supposed to snore. They're supposed to sleep quietly through the night. And they're supposed to breathe through their nose. And so I said, there's no way Maddie snores on my watch. I know about this stuff. I want you to go home, and I want you to videotape her sleeping, and I want you to send it to me. And this is the video that I got. Every breath makes a sound. Notice her head posture and her mouth. So all of the things we've learned yesterday and today of how the tongue affects our jaw growth and our maxillary development, what do you think's happening to her maxilla when she sleeps? I knew there was a problem here just from watching this video. I was having a hard enough time in my hometown getting an ENT, a physician, to listen to me, a tooth guy, an orthodontist who knows nothing about breathing or ear, nose, and throat medicine. So it was tough for me to get the ball rolling in my own town about sleep-related issues. So I told Adrian, Maddie's mom, I said, we're going to collect a whole bunch of evidence before you get to the ENT, because I don't think they're going to listen to you. So I said, I need you to get an image of Maddie, and we're going to get a cone beam CT, a 3D image. This is what Maddie's 3D volume rendered dentition, maxilla, mandible, and airway look like. As orthodontists, we focus on the teeth, because that's what we were trained to do. Not often do we get to see 3D scans of 4-year-olds. So you're seeing a full mixed dentition, a full primary dentition with the permanent teeth already stacked and lined up, ready to fly in with no room at all. Now, as we know, primate space is normal. So these baby teeth should have a lot of gaps between them, and that doesn't exist. You're probably already looking a little bit at her occlusion, how her jaws are coming together, and notice that her bite was a little squirrely. She was already starting to try and find that cross-bite relationship. Where do these teeth fit best? She's got increased overjet, narrowness of the maxilla, crowding. This is her airway. Now, what you've seen already from Airway, and we got a wonderful introduction just within the last hour and a half of how this tube is really just a tube that's passing air from your nose to your lungs. The actual anatomy of the tube isn't the most important thing, but it is an important thing. If you look at the tightest point on this airway for Maddie, it's like a cocktail straw. So I told Adrian, okay, great, you're going to take this video that I just made for you, and you're going to take that video of Maddie sleeping, and we're going to get a radiology report. So we sent the cone beam for a radiology report, and this is what we got back. And you'll notice that what we have on this radiology report now is an anatomic description of the airway that says, hey, this is not normal for a child. this should likely be addressed. From a medical radiologist now. So what that means is we have this whole armamentarium of stuff to take to the ENT, and I still thought we were going to have a challenge on our hands. So Adrian shows up at the ENT's office with her laptop and a thumb drive and printed out material of all of this. And to my surprise, Maddie was scheduled instantly for her tonsillectomy and adenoidectomy. I did not expect that reaction. And this is the text that I got from Mom. Adrian sent me this. She didn't even need to do a scope or anything. Saw a video of Maddie sleeping, read the report, watched the video you sent, looked in her throat, saw the giant tonsils, and she was convinced. This is how I want all of those interactions to go. This is perfect for that ENT orthodontic relationship. But the story gets even better. This is a text I got from Adrian after the TNA procedure. Maddie had her tonsils out, and adenoids were obstructing 75% of the nasal airway. What we just learned in the last hour and a half, that velocity, that movement of air through the nasal space is important. We need to turn that up. 75% of Maddie's was blocked at the back of her nasopharynx. One tonsil was lying on the other when she was sleeping. This is the stuffed tonsil that Maddie got when she had her procedure. I think this is really cute. They actually have these stuffed animals for every organ in the body, and they give them to their kids when things get removed. Now, a couple weeks go by, and I get another text from Mom. Made it through the recovery process. Maddie's loving eating crunchy things again. She's also sleeping quietly and has had dry night diapers. She was still wetting the bed at 4.5. Her nocturnal enuresis went away immediately after she could breathe. That's a huge effect on a child's life. It's a huge effect on the parent's life and the family's life. As orthodontists, we can affect people's lives in this way if we're just observant. And I'm not arguing that we need to become sleep physicians. We just need to hit the places where it will affect these kids. And earlier is better. This is how Maddie sleeps now. If you look at her side by side, how she used to sleep on the left compared to how she's sleeping now on the right. Adrian can't pick up snoring volume anymore. But just look at the way the chest moves. Look at the head posture. Her lips aren't together yet. She still needs retraining. She still needs nasal breathing back. But even her hair is better. She's sleeping so much more comfortably. Just having one patient like this will change the way you practice. And I think it's important for us to look as teeth people, because we're often the first people that can be advocates for these kids that have airway difficulty.